Hello, everyone. My name is Jisela Hernandez, and I am a social worker for the LA County Department of Children and Family Services. For the last 6 years, I have been a treatment worker, working with family maintenance, family reunification, and permanent planning. But for the last year, I've had a very unique role by being a partner of the Magnolia Community Initiative, which is south of downtown LA, and we're 1 mile by USC. And we're housed at the Magnolia Center. We have a county suite, and we have 3 departments from the county housed at Magnolia Place. We have myself, which is the Department of Children and Family Services. We have DPSS, which is the Department of Public Social Services, and we have child support. In addition, we have Children's Bureau case manager housed there as well. Nowhere else in the county are there county departments co-located at a family center. We work alongside with nonprofit organizations in order to help the area around Magnolia Place improve everything from parenting to economic stability, from health and to education. Let's see. It's very different what I do for the County of Los Angeles as to right now what I'm doing at Magnolia Place. Previously, I worked with families, and it was about providing linkages, and it really was up to the parent to look for those resources or, do it on their own. The difference here now is that when families are coming here, they're ready for the change. They want to change, they want a difference in their lives, and they're willing to open themselves up to let us know what's going on in their lives, and they're willing to allow us to help them as much as much as we can, and as much as they're able to receive our help. Let's see. How do referrals and linkages work among different services? A lot of the services that our families need are already based at Magnolia Center. At Magnolia Center, we have the Children's Bureau, which is a mental health agency for children 0 to 18. We have St. John's, which is a nonprofit medical center. We have a pediatrician, we have a primary doctor, we have a dentist, we have a pharmacy, all of this at low or no cost. We have what's, in regards to referrals and linkages, we do what's called a warm handoff. So whenever a client comes here and asks for a certain service, we always inquire what their needs are, and depending on their needs, we won't just say, well, you can go over here. We will actually walk them over. An example of this is I had an ER worker, so emergency response worker, that told me that a certain client needed parenting classes and anger management and substance abuse classes. Of course, the client came really upset, complaining, and so I listened, and I was listening to him, and as I was listening to him, I noticed that his left hand, was very swollen. So I inquired, hey, what's going on with your hand? And he's like, I don't know, I don't have time, I'm working all the time, and they say it's stress. And I said, we have a clinic right here, why don't we walk over there? So I didn't just send him to the doctor. We walked over there, we went to the front reception, we showed him his hand, and they were able to see him. And my client was there to get parenting classes and anger management classes and substance abuse, but he was able to get linked to the doctor and get ongoing care for free Not only that, he actually came back a few weeks later because there were issues with child support. But because I had already informed him of all the services that were there, he was like, Jisela, I came here because I got a letter and I don't know what this means. And we were actually able to help him with much more needed services that he needed beyond what he was required to come. What does this have to do with child development? It has to do with a lot, because I believe that a lot of our children are being guided by their parents, and a lot of the needs are by the parents. These parents are coming back. When they notice that one service is really good, they're going to continue coming back for more services. So what came as a referral for parenting winds up, healthcare access winds up where the children are returning and they're going to the reading club to learn how to read, and other issues are being resolved. Let's see. Another referrals and linkages that we provide and that we work with is we work a lot with other agencies, and we're also working with our families with modeling, coaching. The difference is I don't have a time limitation with my clients. I can spend up to 4 hours or more if my clients need that. That's something that I couldn't do before. Let's see. Some of the challenges and barriers with our children and our families. A lot of our families don't know about the services that are available to them, and that causes a lot of barriers. A lot of our families don't know about things such as the regional center. They don't know what developmental delays are. They don't know what a speech delay is. They don't know what autism is. There's a lot of stigma of mental health, so a lot of parents are very wary of taking their children for an intake. They don't know what an intake is, so that's where we come in. We explain everything to them. There's a lot of poverty issues, especially we are in a catchment area that's partly South Central Los Angeles, partly Pico Union, partly Westlake MacArthur Park, and Koreatown. So there's a lot of poverty issues there. There's a lot of families that are undocumented. We have a lot of illiteracy with families. There's also there's also a great need for healthcare literacy. We had one family that came in. I was asked to help the mother get services for the daughter because the mother was not taking the child for mental health services. But upon talking more with the mother did not know how to read or write in Spanish. So she couldn't, she had limitations in her own language. She had even more limitations in English. And what was supposed to be neglect was really not knowing how to access service. And she was embarrassed to tell their providers, I don't know how to read and I don't know how to write. And we were able to help her. I was able to get about 400 pages of all of the mental health hospitalizations of her daughter, organize them in a 4-inch binder, and hand that to her so that whenever she would go to future hospitalizations, therapy, the mother had everything that she needed in order so that the future therapist or the future provider would have a history of that. And that wouldn't be possible if we weren't there. It wouldn't be possible because with LA County Department of Children and Family Services, there's such high caseloads. I don't know any social worker that would be able to, even if they wanted to, they wouldn't have the time to do that. So that was a big help. And through Magnolia and through our partners, we are helping them to, get access to services. Not only that, but linking them to a nonprofit in our area that teaches families how to speak Spanish, how to read and write in Spanish. So, sorry if I'm jumping around, but I think the main point is that Magnolia Place, we're taking a really holistic approach. We are asking beyond what we need to be asking. We're going out of our scope, and we are, for me, it's not just about the department's need, it's what are your needs, and really going back to the basics of what our clients and what our children need, and starting with that. So, yeah. Thank you.